Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.
I'm Roby Brock with your Talk Business Arkansas update. We begin with a story about Walmart and the steel mill super project in Northeast Arkansas. Following in the steps of e-commerce giant Amazon, Walmart officials announced plans to begin testing the use of self-service storage lockers in a limited number of their stores this summer. CEO of Walmart's e-commerce unit made the announcement to a group of reporters on Media Day in San Bruno, California on Tuesday. A Walmart spokesman confirmed that the lockers will be available in roughly a dozen stores by early summer. However, with more than 4,000 U.S. locations, Walmart has a clear advantage for rapid order fulfillment if details are worked out and the entire store network is involved in the locker room model. Many of those stores are also open 24 hours a day, which could provide more convenience for shoppers. There's a lot of thoughts swirling around the state capitol and the Big River Steel project as legislators debate whether or not to float a $125 million bond issue to support a loan and incentives for the $1.1 billion steel mill to be located in Osceola. The project's expected to create 525 initial jobs and thousands more in the construction phase and through a supplier base. There was a marathon 5.5-hour meeting on Monday where lawmakers heard from economists, state officials, and representatives of Nucor Steel and Big River Steel. Also, details of the proposal have been added to Senate Bill 820 in a 52-page amendment. It could be considered in the Senate Agriculture and Economic Development Committee on Thursday. And you can read more on this Big River Steel story on our website at talkbusinessarkansas.com. When we come back from this break, we'll talk politics. We take a look at some of the action at the Capitol today, tax cuts, and a veto override of a voter ID bill. Plus, later in the program, I'll sit down with Ray Hanley. He's the CEO of the Arkansas Foundation for Medical Care and a former state Medicaid director. He's leading a coalition of businesses that support expansion of the health care insurance program in Arkansas. I'm Roby Brock. This is Talk Business.
I don't think it's going to be an easy conversation because they are very strong-willed. I think it's going to be important to us that we know that you're somewhere in a facility that looks after you, has compassion, has care, and you respect it. I mean, I'd love to look after them, I'd love to be able to take care of them, but I don't think I could. That'd be a wrong choice on my part.
Arkansas's skilled nursing and assisted living centers provide quality care for our seniors.
Farm Bureau helps protect its members in more ways than you might think. They've always been the voice of agriculture in Arkansas, working on behalf of folks like me when nobody else would. And Farm Bureau stands for the values that Arkansas families care about. They've protected my right to farm and make a living, which helps everybody who likes food on the table. You know what they say, Arkansas counts on agriculture, and agriculture counts on Farm Bureau.
The Arkansas State Chamber of Commerce and Associated Industries of Arkansas. The State Chamber AIA is the leading voice for business at the state capitol and serves as the primary business advocate on all issues affecting Arkansas employers. Our mission is to promote a pro-business, free enterprise agenda and prevent anti-business legislation, regulations, and rules. Now more than ever, business matters. Learn more at arkansasstatechamber.com.
In politics today, a veto override, yes, another veto override, and tax cuts top our political headlines. The state Senate overrode Governor Beebe for a third time this session. On Wednesday, the legislature has overridden 2 bills that Beebe vetoed related to abortion laws. Today it was the voter ID bill. Beebe vetoed the bill that would require a photo ID to be shown at the polls earlier the week. With the Senate override, it now goes to the House for a potential override. Governor Mike Beebe also today named Charles Cliff Gibson of Monticello to the University of Arkansas Board of Trustees. Gibson established his own law firm in Monticello in 1981. He's worked there ever since. He also serves as county attorney for Drew County. The appointment replaces Mike Aiken of Monticello, and his appointment expires in March of 2023. Late Tuesday, House Speaker Davy Carter received approval for his capital gains tax cut bill, HB 1966, which raises the exemption level on new and existing investments. The House Revenue and Tax Committee approved the measure on a voice vote late Tuesday afternoon. The bill moves the capital gains tax exemption from 30% to 70% on two sets of investments. The first level of investment involves new investments starting July 1st, 2013. By definition, income is considered an investment if it's held for more than 1 year. The bill also moves the exemption level to 70% on existing investments in excess of $5 million. After this break, we turn our attention to healthcare reform. I'll sit down with Ray Hanley. He's the head of a coalition of healthcare and business leaders that want to see a healthcare insurance expansion done in this legislative session. Ray Hanley with his thoughts when we come back.
Noble Strategies is a bipartisan state and federal government affairs firm with a successful track record of providing effective advocacy for business, government, and nonprofit entities. Noble Strategies provides service in areas such as lobbying, public affairs, trade association management, and marketing campaigns. Learn more at noblestrat.com.
I was looking for a bank that could best protect my finances.
It shared my passion for my business's potential.
A bank that offered investment expertise,
lending support, insurance guidance.
A bank that delivered full financial support.
That's how I found True Balance.
True Balance.
From my bank.
From my bank.
Delta Trust and Bank, the expertise to meet all your financial needs.
One of the real advantages of electric cooperatives membership is having a voice in our state's energy future.
Not a week goes by without important energy issues making headlines. These are issues that need to be discussed. And you should know that as policies are being developed, the cooperatives are looking out for our members, advocating what's best for you.
We are your friends and neighbors.
We are your local electric company.
The electric cooperatives.
We are Arkansas.
Joining me now is Ray Hanley. He is the CEO of Arkansas Foundation for Medical Care. He's the chairman of the Arkansas Health and Jobs Coalition, and he's a former state Medicaid director.
Yes.
Did I get all of that right?
You got all of that. 8 years with Hewlett-Packard in the middle, but yes.
Let's talk a little bit about what's going on here at the state capitol in terms of whatever we want to call it, Medicaid expansion, end of Obamacare, Medicaid contraction, the private option. How do you kind of define it?
I think this can appropriately be called healthcare expansion to low-income, hard-working Arkansans who won't get coverage, most of them without doing this legislation.
We have seen reports from DHS that if we go forward with this private option plan through the health insurance exchanges, that it could cost as much as 15% more. That does not necessarily equate to a better value for straight Medicaid expansion, but do you think it is still something that works?
Yes, I do, and it works well for a couple of reasons, Roby. If you just do the regular Medicaid expansion, being able to get enough willing providers at the Medicaid fees to see these patients would be problematic. You would run the risk of too many defaulting to the ER because they couldn't get an appointment. I think if you do the private option, you're able to pay market premiums. The plans are able to pay market rates. I think you'll have a lot more doctors willing to give the patient appointments, see them in an appropriate setting. I think then the community hospitals will be paid appropriate market rates that Medicaid otherwise couldn't pay. The hospitals have been more viable. Access will be better. I think it's a good plan. I think it'll work.
We still hear everything is a little bit theoretical at some point in time here, is that you've got the fact that people believe that this will bring more competition into the marketplace. Mm-hmm. Do we know it will bring more competition into the marketplace, or we just think it will?
Well, you can't be 100% certain because nobody's done this before, but the laws of economics, you can be reasonably confident that if you put 250,000 more customers into this insurance exchange prepared to pay market level premiums, that there will not be additional insurance companies interested in coming into this market to compete for those customers.
How does that compare with, we've seen reports recently that there's an expectation that premium cost will be rising by an astronomical amount, really, by the estimate that was in the reports.
I saw the article today. I think 40% is the number quoted. I think that is a national average. I think with that question, rates are going to go up. They've been going up. I mean, for one, healthcare is not like any other commodity. It doesn't respond to the same market pressures. Even before Obamacare, I mean, we've all seen insurance premiums going up 3 times the rate of inflation. So there's that to deal with. But regardless of whether you do the Medicaid expansion, premiums are going to go up. Part of it, I'm sure, is driven by the new requirements in the healthcare law. But I have to believe that if you take 250,000 comparatively young and healthy people, many of them are, hardworking folks, they're adults, put them into the exchange, that's not going to level the pool a little bit and put more pressure on the companies to bring down their rates. Because the sick people, particularly anybody below poverty, they're going to come to the exchange anyway, because that's going to be their only avenue to get coverage and subsidized coverage. So you're going to have a high cost there. But if you take the 250,000 comparatively healthy, comparatively young Medicaid folks and put them in there, you're going to level that pool. And I think you have a chance to bring everybody's cost down.
Your coalition represents who? Kind of give me a thumbnail sketch.
Well, it's a community grassroots effort. I mean, its members include the Arkansas Hospital Association, the Medical Society, the Pharmacy Association, AARP, a number of groups there. I think there's 30 last count I looked, and there are still people joining every week.
And you guys are engaged with Republican legislators, Democratic legislators, the governor on all this. Tell me a little bit about what's kind of in negotiation right now. I don't want you to tip your hand, obviously, on anything confidential, but there are Medicaid reforms at work on the old system, per se. There is this new hybrid that we're experimenting with.
Well,
what do you think happens?
We have thrown our support behind the private option, because I think that's probably the only way to get a bill passed. And I think everybody's accepted that. That's what everybody's moved behind. And we're talking, as you said, to the legislators, Democrats, Republicans, and trying to help generate enough support to get the 75 votes.
Maybe not the $64 million question, maybe a multi-billion-dollar question when we're looking at this and over the long term. Do you think the votes are going to materialize?
I think that there is a good probability that they will, and I think at the end of the day, they will materialize, even though a lot of people have had problems with this being linked to Obamacare, and obviously there's a lot of reasons to be concerned about that, other parts of the law. But the reality is, it is the law. The Affordable Care Act or Obamacare, take your pick, it's here. And without the Medicaid expansion, this law is going to have some really harmful effects on this state. So I have no problem at all calling the Medicaid expansion or expansion for health coverage, as it would be through the private option, the anti-Obamacare, because it protects employers, because without the Medicaid expansion, anybody that employs 50 or more people is on the hook to either provide insurance or pay a penalty. Without the expansion, nobody under 100% of poverty is eligible for anything. Anybody above poverty gets subsidized coverage through the exchange. But if you don't do this expansion, you're going to have probably 150,000 low-income people in this state, many of which work hard every day, serving all of us. They make up the beds at the motel, they put the food on the table, they take care of the elderly. They will have no option for coverage. They'll continue to be uncompensated. They'll continue to be a burden on the local hospitals who provide care but can't be paid. You run the very real risk of losing some of the community hospitals without this. And I think all that combined at the end of the day will help us reach a good faith compromise around this private option that will get it done. That's certainly my hope, and I think it is realistic.
So your viewpoint of status quo or doing nothing is we head into a dire circumstance for rural hospitals and for people, they do not have any health insurance options.
Absolutely, because again, anybody below poverty will have no options because the law did not provide for anybody below poverty other than this expansion option.
All right, Ray Hanley with the Arkansas Foundation for Medical Care. He's the former state Medicaid director for the state. He's the chairman of the Coalition for Arkansas Health and Jobs
yes, close
Coalition.
Enough.
I was
close enough.
good there. I'm Roby Brock. This is Talk Business. We will be back tomorrow.
Talk Business Arkansas is brought to you by the Arkansas Farm Bureau, the Arkansas State Chamber of Commerce and Associated Industries of Arkansas, the Electric Cooperatives of Arkansas, Noble Strategies, the Arkansas Healthcare Association, and Delta Trust and Bank.